All right, let's talk about the OET. If you're a healthcare professional gearing up for this test, you already know it's a huge step for your career. But here's the thing. The problem isn't finding study material. It's that you're drowning in it. So today, we're cutting through all that noise. We're going to build a clear, simple roadmap to get you to success using only the best resources out there. Let's dive in. Does this feel familiar? You type OET prep into a search bar and boom, it's just a massive wave of information. If you're feeling overwhelmed by it all, trust me, you are not alone. The real trick isn't finding more material. It's about finding the right material and actually knowing what to do with it. And that's exactly what we're going to figure out right now. So here's our game plan for today. First, we'll quickly cover what makes the OET so different from other tests. Then we'll build your official toolkit, using materials straight from the people who make the test. After that, we are going to do a deep dive into mastering the writing subtest, because that's a big one. Then we'll look at some awesome third-party tools, and finally, wrap it all up into a winning strategy for exam day. Okay, first things first. Before you can conquer the OET, you have to really understand what it is, and just as important, what it isn't. You've got to understand the challenge you're up against. So, the OET, the Occupational English Test. This is not just another English exam. You know, it was literally designed by healthcare professionals for healthcare professionals. Its entire goal is to check if you have the specific English skills you need to communicate safely and clearly in a real hospital or clinic. And this slide right here shows you the single biggest difference. A general English test might ask you to talk about, I don't know, environmental issues. But the OET, it's going to hand you a patient's case notes and say, write a referral letter. Every single part of this test is based in the real-world situations you already deal with every day. Okay, so you're ready to start prepping. Where do you begin? The answer is simple, and it's always the same. Start at the source. The official materials have to be your foundation. Everything else is just extra. Think of these 3 websites as your home base. They are absolutely non-negotiable. OET.com is the main hub with all the official info. OET Ready is their specific prep platform. And the OET blog, it's a goldmine of tips and news straight from the test makers. Seriously, you should probably just pause and bookmark these right now. And you know, the best part is just how much amazing stuff they give you for free. You get full sample tests for listening, reading, writing, and speaking. You get a whole study guide, plus video lessons and webinars. Before you even think about spending any money, you need to be all over these official resources. They're the best way to learn the test inside and out. Now, let's zoom in on what many people find to be the toughest part of the OET, the writing subtest. This is really where your clinical knowledge and your language skills have to come together perfectly. So here's the deal. You get a set of patient case notes. Looks a lot like a real patient chart, and you've got 45 minutes. Your job is to write a letter. It might be a referral to a specialist, a discharge summary for a family doctor, or maybe a transfer note to another ward. It's a super practical, job-focused task. Okay, this is absolutely crucial. You need to know exactly how your writing is scored. They use these 6 criteria. Purpose just means, is it obvious why you're writing? Content is about choosing the right patient information. Conciseness and clarity means you get straight to the point. Genre and style is about sounding like a healthcare professional. Organization is having a clear structure. And language is, your grammar and vocabulary. If you can nail these 6 things, you're going to get a great score. Now, listen to this, because this is a huge tip. This is basically an OET examiner telling you what they're looking for. This test isn't just about writing. It's about your clinical judgment. They will intentionally give you more information than you need. Your job is to figure out who you're writing to, what they need to know, and then select only the relevant information for that person. Getting this right is probably the biggest challenge for most people. So, how do you get good at this? Well, please, don't just jump straight into doing 45-minute time tests. That's a recipe for disaster. Follow a progression like this. First, just practice turning messy case notes into clear, single sentences. Then, practice grouping those sentences into logical paragraphs. Then, write a whole letter, but don't worry about the time. Only when you're comfortable with the structure and content should you start putting yourself under that 45-minute clock. All right, so once you have a really strong grip on the official materials, then you can start to expand your toolkit with some excellent third-party resources to supplement your learning. You know, YouTube can be an amazing tool if you know who to watch. The official OET channel is a must, of course, but channels like E2 OET, Specialist Language Courses, OET Online with Jay, and Swish English, they all offer really high-quality lessons, examples, and strategies that fit perfectly with the official stuff.
Okay, you've got the knowledge, you've got the resources. Now it's time to pull it all together into a smart, effective strategy to take you through to exam day. A winning strategy really has 4 key ingredients. 1, make a study plan that's actually realistic for your life. 2, use a good mix of the official resources and some of those trusted third-party ones. 3, and this is so important, you have to do timed practice tests regularly to get your speed up. And 4, don't just do the tests. Go back, analyze your mistakes, and really try to understand why you went wrong. And if you can, get some feedback on your writing. It's a game changer.
Look, as you get deeper into your studies and the pressure starts to build, I want you to always come back to this. The OET only has one real goal: to make sure you can communicate safely and effectively in an English-speaking clinic or hospital. It's not about trick questions, it's about patient safety. Everything you're doing is to prove you can do that. So, we've laid out the entire map for you, from understanding the test to building your final strategy. The path is pretty clear. The only question left is, what's the very first step you are going to take on your OET journey today, as soon as this is over?